Hi everyone, so we are learning endocrinology and the topic we are going to learn is thyroid gland. So you can see the picture. Here you can see the thyroid follicle, a lot of thyroid follicles. So inside this pinkish material it is the colloid and surrounded by you can see this follicular epithelial cells. So these together will form the thyroid follicle. Now when you look at this picture you can see the brown staining, so it is immunohistochemistry staining, and here you can see these are the follicles. So this is outside of the thyroid follicle. So here you are staining calcitonin positive, you get calcitonin marker is positive. So this is for staining the parafollicular C cells. So because calcitonin, the source of calcitonin is from the C cells, so that's why it will be stained by calcitonin marker in immunohistochemistry. Now we are going to learn about certain thyroid function test. What are the hormone serum level we will be checking for knowing about the functioning of thyroid, so that we are going to learn now thyroid function test. So first one we are going to learn a serum TSH. So serum TSH, it can be increased or it can be decreased. So it will be increased in hypothyroidism and it is decreased in hyperthyroidism. And you should remember that the hypothyroidism, it can be actually presented with symptoms or without symptoms. So with clinical symptoms, then it is clinical disease. If it is without clinical symptoms, then it is subclinical. So suppose if a patient is having hypothyroidism, that means there is elevated TSH, but the patient we cannot definitely say that the patient will have symptom. Sometimes the patient will be not manifesting any symptoms, so that condition is actually subclinical. The other one, if he or she is manifesting the symptoms, then it is clinical. In both cases you can actually get this elevated TSH level. So by looking symptoms, if it is present or not, we cannot say how it is hypo or hyper, but you can look the TSH value and you can find out if it is increased it will be hypo, if it is decreased it will be hyperthyroidism. So it is actually the very good parameter that you can look for knowing the functioning of thyroid. Now we will be going to serum T4 levels. Again serum T4, we have to say that it can be in two form, free T4 it will be there, or the bound form. Bound form means it is bound to the plasma protein. It can be bind to thyroglobulin, thyroid binding globulin, or proteins like transthyretin, like that. So free T4 means it is just free. So what is the problem if it is bound to plasma protein? In human beings, we know there are certain conditions which can increase plasma protein as well as decrease plasma protein. So according to that, this bound form of T4 will be varying. So we cannot exactly by looking this bound T4, we cannot exactly say that is the actual amount of T4 in our blood, because that can vary according to the level of plasma protein in our blood. For example, if a patient is having nephrotic syndrome, we know the protein will be less. So in that case the bound T4 will be less. Or if the patient is having anabolic steroid, and in that case also the plasma protein will be less. So the bound T4 will be less. So we cannot know the exact value. So we have to go and look for free T4. Free T4 is good one. And the symptoms that is arising is also because of this, depending on this free T4 value. Now in another case where if a person, a female, is having oral contraceptive pill, or if she is having hormone replacement therapy, or if she is pregnant, in all these cases the plasma proteins in her blood is increasing, elevating. So in that case the bound T4 will be high. So you should not look at bound T4, you should look at free T4 levels in the serum. Now after this, which are the other levels which we look, is iodine 131 uptake. We also look at this iodine 131 uptake. So here you can get an increased synthetic capacity. That means we know this is the thyroid gland. So you know iodine is thyroid gland is a tissue which can intake many thyroid iodine. So it can intake iodine molecules, isn't it? So iodine 131 and iodine 123, these are the two isotopes which we use. Now you should remember that, so whenever we are giving iodine, mostly what happens normally, it is all the area will be taking it at the same way, but sometimes, so this is the case of a normal one, sometimes what happen, it is all the area will be taking in the same way, but some area it is taking it very high, so it appears very dark. So some areas it is taking more iodine, there is increased intake of iodine, increased uptake of iodine. So that condition occurs when there is an hyperactivity of the gland. So which are the examples for hyperactivity of the gland? That is Graves' disease, toxic nodular goiter. In these conditions, now sometimes all the areas will be taking it, but some area it will be less intake, so that area will be very pale. Okay, just opposite of what we have seen right now. So there is decreased uptake of this iodine. So when there is increased uptake, we call it is the hot nodule. Then you can imagine here we say it is cold nodule. So cold nodule observed in case of cancer, or we say malignancy, and thyroiditis in case of inflammation. So when you get a cold nodule, you should be very alert, because you can suspect a malignancy. It can progress to a malignancy, or it can be in inflammation, thyroiditis. So you can remember cold, C for cancer. Now hot, H for hyperactivity. So it is easy to remember, hyperactivity of gland. Examples are Graves' disease, toxic nodular goiter. Okay. Now the other protein we are looking is serum thyroglobulin. So it is a marker for thyroid cancer. So I'll write it here again. In cancer, thyroid cancer, you have serum thyroglobulin. It is a marker, serum marker. Okay, so all these you should remember. What are the things we have said is about iodine 131 and 123 uptake, hot nodule, cold nodule, the conditions when it is getting elevated, and you should know about serum thyroglobulin, then serum TSH and serum T4 levels. The good parameter is serum TSH. In serum T4 you should go for free T4. Okay. So in this picture you can see here, you can see that the entire area, it is you can see the thyroid. This is the thyroid gland. So all the area it has taken evenly except for this area which is pale. So this is a cold nodule. Now here the thyroid gland you cannot differentiate because, and one area is highly dark, so that is a hot nodule. Okay, here you can see a lot of nodules. So this is an MNG, that is multinodular goiter. Here because you have a lot of nodules, that's why you get a lot of darkened areas. So that is the case of multinodular goiter. This is cold nodule, it is pale. This is a darkened area. Comparatively with the other, you can here you have the thyroid gland, which is comparatively it is paler because this area has intaken more. That's why it is dark. So it is hot nodule. This is cold nodule, a case of MNC. Okay. So that's all. Thank you.